Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, everyone. Welcome to Impact by DIFFA Dallas. I'm Reed, and we're joined today by Jennifer Collins of the Resource Center and Tess Kucera of the UNT Student Health and Wellness Center. Thank you so much for being here.
Thank you.
We're excited. Okay, let's start off a little bit. Tell us about your separate organizations. Jennifer?
I'm with Resource Center, so we serve the LGBTQ and HIV communities in North Texas. Last year we celebrated our 37th anniversary. We started in 1983 as a food pantry for those living with HIV, and we've just expanded from there. And we have social programs for the LGBTQ community, but we also have health and wellness programs for those living with HIV, and a big part of what we do is prevention as well of HIV.
Yes, and so I work at the Meadow Center for Health Resources at the Student Health and Wellness Center at UNT. And as the health educator, I mainly work with students, educating them about sexually transmitted infections, as well as helping manage the Condom Club, where we pass out safer sex kits and a lot of different types of things just to educate students and help them understand how to have safe sex.
Nice. Well, welcome to the show. So let's start off a little bit by telling me maybe what your respective organizations are doing for the community in and of itself. I know you're saying the programs you're doing and how long you've been around, which is amazing. But tell us like the individual things you're doing to impact the community. Jennifer?
Sure.
Whoever wants to.
Okay, I'll jump in. So with Resource Center, as I said, we do have a lot of social programs to reach the community, and they start from age 12 all the way up. Mm-hmm. So even though we have social programs, we have prevention programs too. So our kids that are in our Youth First program, for example, they're ages 12 to 18, they learn about safer sex, to be healthy sexually, and to get that word out and educate them from an early age of what that looks like, because HIV is still a prevalent chronic illness and there's still a lot of stigma around it. Mm-hmm. And so we really want to be able to have these healthy sexual conversations with ages 12 all the way up. And we still have these conversations even with our Thrive group, for example, that's age 50 and over. Oh, wow. And so giving them information as well, what the latest information is, just to stay healthy. And if they also have HIV already, giving them support through support groups and learning about the latest needs and medication that's out there for them to take. Yeah. And so
well, the medical advancements in and of themselves, I feel
absolutely.
Like. And actually something I would say to both of you, speaking on like a younger crowd, is how do you feel, or what is the reaction of a younger group now to the idea of HIV and AIDS, to prevention, to a stigma-free environment? Because what I find is that the younger people now really kind of don't know about what we've been through before. So how does that, maybe Tess, walk me through that education process. Like, is it more explanatory? Is it more story-driven? Like, how do you go about, I guess, informing them of these things? Yeah,
definitely. So our population is college-age students for the most part, so like 18 to 24, 25. And one of the things that I do is really stress the importance of getting tested. Mm-hmm. And so talking about different STIs and as well as HIV, and letting the student know that it's very important to get tested because regardless of what the results are, it can be very manageable if they are positive. So just talking to the student, educating them, letting them know that some STIs don't have signs or symptoms. And then when it comes to HIV, letting them know how that can be transmitted. Mm-hmm. And just educating them on both transmission, but then also what to do after you get tested.
Right. Like where you go from there.
Yeah, definitely. So I don't think HIV is necessarily on the students' minds, especially when they come in to talk about safer sex practices. I think they automatically think of different things like chlamydia or gonorrhea or maybe herpes. But I always do make sure they understand that HIV is still something that they could come in contact with and that they need to protect themselves for. So doing a lot of prevention. And then helping them know what to do if they find that they are infected with HIV.
It's so interesting to hear you say, though, too, that you use sort of the same tactics with a very younger generation that you use with a more advanced, like senior community. How does that kind of, do they ever interact, the two of them? Okay, I think that's kind of cool.
Yeah, well, because like you said earlier, this generation might tend to think that HIV is something from the past
Right.
and that it doesn't occur anymore. And so it's really important to let them know that, yes, this is still happening, it's still preventable. And so the two groups will get together and talk about what the youth are doing to help fight the spread of the disease, but then also get that history from the older generation to see what have they already done, what have they gone through, what are the steps that they've accomplished that they can also emulate or take ideas from, and just to get their personal stories from that. And then in the middle ground, we also have several groups that are 18 to 29, and you mentioned stigma. A lot of these cultures, like for example, our Hispanic culture or Black culture, it's definitely stigmatized still. So we have programs that are specific to this demographic so that we can reach out to them and do prevention with them, but bring a more cultural spin to it. So for example, our UB, United Black Element group, they do Kiki Ball and Vogue dancing every Friday night. Yeah, and they do like a watch party of Pose, which has a lot of great prevention tips in the show itself. And so they'll just come to it culturally and in a language that they're used to, that they're that's understandable and they can relate to, instead of like a very clinical way of explaining things.
That's fascinating, though. I mean, like, you're two groups that are very, honestly, kind of go hand in hand. So nowadays, what's great is that there are these preventative organizations and really more exposure-driven, like, say the word, repeat it, it's okay. Like, the more it's in the process, the more, I think, comfortable people become with it. So it's fantastic to have something like the Resource Center with such a heritage and like a lineage in the community, and then you have people in a college-age setting and technically a younger generation that can come up already knowing these things, which would just impact the Resource Center even more. So speaking of impact, though, how has DIFFA impacted your organizations?
Yeah, so through grants that we've received from DIFFA, we've been able to hold events in the past that encourage testing. And then one thing that we're working on now that we're really excited about is our Safer Sex Kit vending machine, which will be located on campus. So that will be an opportunity for students to go swipe their ID and then get a Safer Sex Kit. These include things such as regular standard condoms, as well as dental dams, insertive condoms, flavored lube, non-flavored lube, flavored condoms. So a whole bunch of different things just to encourage safe sex practices. I always like to tell the students that lube can be their best friend, and it also can help, prevent any sort of tearing. So these are just different things that I can do to help the student understand that there are things that they can do to protect themselves and to make sex more fun.
Yeah.
Well, it's self-care in a way.
Yes.
It's taking care of you.
Yes, definitely.
Which is awesome.
Yeah, so we're really excited to have this vending machine option. We currently have our condom club where students can come once a week and get the Safer Sex Kit, but the vending machine will allow for more access. It'll be in a building that has late hours. And we're just hoping that it'll increase access, and if it works well and if the students like it, then in the future we can get some more on campus as well.
Nice. Jennifer?
Well, DIFFA has such a huge impact on Resource Center because you're such a well-established organization. So not only do the funds go very far with us in safe sex kids, with education, prevention, events, you also really, what I love about DIFFA is that you all walk the talk. There's so many times where I've gone to our health campus where we have a food pantry and hot meals program for our clients living with HIV and see DIFFA members there volunteering and donating their time to the center. And so that is huge, as well as the grants. And then just also promoting and spreading the word about these other like-minded organizations. You're a trusted organization, so when you support an organization like Resource Center or UNT, other people see that, and then it educates them, and then they want to do some research and find out about what we do as well. So your impact is not, for me anyway, not just grants and funds.
Right.
It's a community-wide promotion that we really appreciate and are grateful for.
Well, we love to do it. And it's also one of those things, too, where I feel what I like about having two different organizations on an episode of the show is that it kind of promotes a unity. Like, there's so many organizations, like, thank goodness, that are out here doing good work. But it's almost like, am I double dipping? Like, if I give to them, I should get it. But the whole point is we're supporting a community. And so it's nice to see sort of a like-mindedness in the sense of, yes, I do represent, this team and I'm with this team, but we're here together for the same reason. So, and like we as board members and we as an organization, as DIFFA as a whole, it's phenomenal. The best thing to ever do is to give an organization the ability to do something they want to do to better our community. And it's very much so a blessing. It's something we don't take lightheartedly. So it's amazing. Tell me a little bit now, though, about where you would want our partnership to go. Like for UNT, for example, with a youth group, with a, honestly, like the next generation of leadership, I would call it. People who'll take our jobs, I'm sure. Where would you see our partnership kind of evolving from here?
Yeah, definitely. I think that we would love to continue to partner with DIFFA and receive grants from you guys. It's allowed us to do a lot of great events on campus to increase awareness about HIV, but then also increase our rates of testing on campus. In the future, we would love, as I said, to have more vending machines for our safer sex kits. And then one of the things that I would like to work on is helping those students that are infected with HIV. Because we do a lot with the prevention side and then the testing side. And we do offer, or we help connect students to different medications. But I think really working with those students who might be infected with HIV or who are at high risk of becoming infected, working with them, helping them stay in school, and just be a regular student at UNT.
Yeah. Well, it's interesting too. I would imagine that on the point of stigma, that is one of our big drivers, is getting rid of it. It's one of those things where you name the puppy so many times, it will become less and less scary. But I wonder, like, as 18, 19, 20-year-olds, is that still there? Is that still a thing that's so prevalent for them, as sort of hiding it or like not wanting to say it? Like, do you have a decent amount, not decent, but do you have is there an amount of students who are very open about it, who are not uncomfortable to talk about it, basically? So
I would say, for the most part, it's still very hidden. I don't have students talking to me about it very often. I think the most I've had is students asking about PrEP and PEP and kind of starting that conversation. But in terms of talking to students who are already infected, students aren't very open about it. And I think one of the reasons that might be is just because there aren't really programs in place to help them thrive as a student, particularly with HIV.
Right. It's honestly the biggest bummer of it all, is that stigma is it's just always prevalent. And it's such a deterrent, I think, from education. I think it keeps students away from getting the information they need to know, from talking to people, from feeling like I'm no different, like, it doesn't like tarnish me. It's interesting. Yeah. And it's a bummer.
It is.
It is. One thing I do think is important, though, on a college campus, because our students tend to be a little bit younger, is that we are getting the students tested if they would like to be. We do offer free and anonymous testing because I would rather someone who is infected know that they have it. And I think what worries me the most is the students who are infected and don't realize it because they haven't gotten tested. So I do think it's important to push the testing and then go from there.
That's awesome. And it's true. It's what you kind of, I feel like it's one of those things where the what if is always scarier than the actual answer. And so once either way, yes or no, but like once you get to that point, it's always less stressful, but it's always that what if or like that fear that kind of like eats at you that would keep people from it. So it's great you're doing anonymous testing. That's got to be helpful for people to not just feel like my name's on a record somewhere.
Right. Yep. Yeah, they can call in and give us any name and we'll do their test for them.
That's amazing. Jennifer, how about you?
Well, we have the same procedures. We do free and anonymous testing at Nelson Thibodeau, our testing facility in Dallas. And like Tess was saying, it's just getting people tested. That would funds from DIFFA would really definitely help us develop that, continue those services to the community, and expand our facilities as well. Instead of being in a concentrated area, it's great that you're at UNT and that we're in Central Dallas, and like you said, it just kind of spreads that knowledge around Dallas.
Absolutely.
Yeah, and not double dipping at all because we're just helping the community overall. And so DIFFA funds definitely help us make that impact and expand our services and get someone that does have HIV onto a treatment plan because it is treatable, but a lot of people don't realize that, and because of the stigma, don't want to know, like Tess was saying. And so funds definitely help us create more outreach, more education, and then therefore prevention overall, which is really what at the end of the day we want to do, is lessen those numbers of HIV cases. So.
Well, and like to your point about things like POSE and stuff like that, I always wonder if by seeing more examples of people living with HIV or seeing it just in more of the mix of conversation, especially for like a younger generation, like does that get brought up? Have you seen any sort of reaction from the community or more involvement because of things like that? I mean, I would think so, but I don't know.
Yeah.
With the youth.
Yeah, definitely on campus. I am fairly new to UNT, but one thing I've realized is that the LGBTQ population is very open about their health. They're always asking questions, and they're very active on campus. And I think that's really important, and it's really fun to work with that group. And I'm really glad that this population feels like they can be themselves on campus, and that they're also taking their own sexual health in their hands and doing what they can to be sexually healthy. Because I know on other college campuses, it can be harder to kind of be who you are and express yourself. And I think that goes back to, like you said, POSE, and some of the other things that have been happening recently where young people can see people on TV who are like them.
Right.
And I do think that's really important.
It's a huge thing, honestly.
Yeah.
How about like with your younger group? Has that kind of incited any sort of impassioned people to be a little more involved, or like have you seen even more bodies coming through the building because of things like that, where they've been sort of exposed to it on a mainstream level?
Oh, absolutely. Our youth group has grown exponentially over the past several years. It's just getting more and more popular because kids can come and just be their authentic selves, talk to each other, feel safe. They can network, make new friends, and get opinions, and just talk to other kids that are like themselves. And it just makes them more comfortable and in a stigma-free environment.
Right.
Yeah, absolutely. And then to see examples on television or YouTube or even in podcasts to see other kids like themselves, it really, really helps. And it starts a conversation too. And so we really want to meet our different groups on their different levels. What are they interested in? What do they like? And so that can start just a regular conversation. Yeah, it's definitely a lot of similarities between Tess's group and our groups.
Right.
So, yeah.
Well, and it's nice to think too when you're younger and you maybe even like not even down to HIV and AIDS, but when you're younger and you're gay, it's like, do I have a community? Like I'm going to find my people or like find my tribe and like fit in. And so what you're both doing is fantastic because you're really giving youth, middle, at all age groups, but also like for you guys with the college campus, you're giving those people early exposure to be able to choose your own family in a way, and people who love you regardless. So I think that's really amazing. So do me a favor, plug your organizations. How can we get involved? How can we volunteer? If anyone watching wants to be a part of your organization, how would they do that? Tess?
So at UNT, I would just encourage people to look to see what we're doing. We do have events on campus for organizations out there that believe in safer sex practices. Seeing how you can get involved on campus during our events, I think is the biggest way that you could help us out.
Awesome.
Well, at Resource Center, there are so many ways to get involved because we do have so many different programs, but volunteering is huge. Donating time is wonderful, and donating funds as well, but donating time, you can really get to know the community, get in there and get involved. And we have volunteer opportunities for our Youth First group. We have volunteer opportunities at our health campus, so working in our food pantry, hot meals program. We even have volunteer opportunities at our community center, Nelson Thibodeau, our testing facility. So one would go to myresourcecenter.org and check that out there if you want to volunteer, specifically myresourcecenter.org/volunteer. We have a huge social following on our Facebook channel too, so we have a lot of events that people can get involved with and just come and check out the center. We do mission tours every month where you can come and learn stories behind our different advocacy, community, and health programs. And it's not so much a tour of our building as it is about a tour of the stories and impact that we have in the community.
Which I think is to me the best part. I think that the heritage and the lineacy and where you've been and where we're going is kind of amazing. So it's really lovely to have both of you here, not just because we all coordinated outfit-wise, but because we really are celebrating a legacy, but we're also celebrating our future with both of your organizations. And so thank you so much for being here.
Thank you.
Thank you so much for watching. Guys, if you have any questions, you can always subscribe, like us, all the cool stuff. And then visit our website, difffadallas.org for more information. Thank you.